Now we're going to start talking about treating injuries and trauma at home. One of the most common injuries that you'll find around the house are bangs, bumps, and bruises. This is by far what you're going to run into most of the time. You know, one of the worst I've ever seen in my entire clinical history was my own son, Arthur, who jumped off something. I wasn't there, hit his head, and by the time I got to him, he had a bump, a purple bump on his head. You know, you hear people say the size of an egg, but it really isn't. His was literally the size of a large egg. I couldn't believe his skin hadn't split, and this was only within 2 minutes of him hitting himself in the head. But he hit himself really hard on the corner of a table, and in no time, it blew up to a large egg of swollen blood. And this is important. With bangs and bruises and bumps like this, you need to get to them immediately. And one of the top treatments you can do immediately is ice. You all need to have ice in your house. If you don't have an ice maker in your refrigerator, just go out and get a couple bags of ice and keep them in your refrigerator. Now, some people like to buy those cold packs, but you know what? They don't work anywhere near as good. If you're going to buy a cold pack, forget about it. You're better off with a bag of frozen peas or frozen carrots. But nothing works as good as just plain old ice. So always have a couple 8 or 10 pound bags of ice in your freezer ready to use anytime you have an emergency. Because when someone hits themselves really hard or has any physical trauma to their body, the body will start swelling, blood will start getting stuck, and ice is an amazing healer. It almost reverses the damage of the impact. I have seen in my clinic and in my life literal miracles when you put the ice on. It's almost like it goes back in time. It's almost like you reverse the injury and the problem goes away. If swelling gets bad enough, then you can get a split in the skin. Now you got to deal with an open wound. You got to deal with the blood. You got to deal with closing a wound. You can't get to a bang or a bump fast enough with your ice. It's got to be fast. It's got to be immediate, my friends. So have a bag or two of ice in your freezer at home all the time. Now I'm going to show you how to make my favorite way to apply ice to the body. Now it isn't in some fancy ice bag. And again, it's not in one of those frozen gel packs or anything like that. It's not in one of those quick close cold devices that you hit and it freezes and gets cold. Those all work, but I'm going to show you something better. It's just how to make an ice bag that gets really cold at home to put on a wound. The first thing you need is any dishcloth or a tea towel, and this is something that everybody has at home in their kitchen. And again, I've learned pretty much all my first aid right in the kitchen. And the second thing you do is dump an amount of ice in it. Now you can just take the ice and put about, at least 5 good handfuls of ice in the middle of this towel. Depending on the size of the area you want to treat, but get some ice in this towel. Now the next thing you do once you've loaded the towel is just kind of put it together. Fold it in half. I got my ice in the middle, and now I'm gathering it, and I have my ice here in the middle. Now, what you can do is you can take a string, but I find rubber bands work really good, and just put yourself a rubber band around it a couple times, and if you feel you want something more, well, put another rubber band. Rubber bands work really good on the dishcloth or tea towel, and now you have a bag of ice, but I'm not done. Now the next thing you want to do is you want to break up this ice. This isn't high tech. Okay, you smash the ice on a good marble or granite countertop like this. Smash your ice up and see, now you got it nice and flat. And crushed ice or smashed ice will also bend around the body more. If you have big ice cubes in there, that doesn't work. It also breaks down the ice, and now you have more frozen surface here. And I can feel this is already getting cold, but not cold enough for Dr. Schulze. What I like to do next is usually I just run to the faucet and run it under the faucet, but I can't get my video camera over there, so I'm just going to pour some water over the area of the cloth and get this whole area where the ice is wet. Okay, now we got crushed ice in a tea towel, really wet, and now it's starting to get really, really cold. Now you want to apply this homemade ice bag, which is freezing cold right now, immediately to the banged or bumped area. Hold it right on it and put a little pressure if you need to. At first the person might cry or yell or go, "Oh, that's cold." Leave it on. They will thank you later. Okay, how long do you keep it on for? Minimum of 5 minutes. I like 8 minutes, but some people now, even doctors are saying 20 minutes. It gets really cold, but not too long because you can actually damage the body by freezing it. Now this right now, I've had this on for about 20 seconds. It is really, really cold. Let me tell you, the fake gel packs don't work well. The instant cold thing's not cold. But you take ice, you put it in a tea towel like this, you crush it up and smash it up, and you pour water over it and you put it on the body. Right now, 30 seconds later, my hand really hurts from the ice. Now, if you're banged or bruised, don't worry about it, because this will make the pain go away. But also, more importantly, you will stop the area from getting so big that the skin will break or burst. My CEO was over here at my house last year with his daughter Isabella, and she banged herself and almost cut herself a little bit, but it got so big it looked like it was going to burst. Then, like I said, we have to deal with much more trauma. But I made an ice bag and put it on her head, and sure enough, within just a few minutes, that swelling went down, the blood didn't get stuck, the fluid didn't get stuck, the chi or the energy or the prana didn't get stuck. Ice is great for unblocking, which is a major part of healing, and reducing the inflammation in an area that has been traumatized. Okay, you want to use the ice on and off repeatedly for at least a couple hours, if not 3 or 4 hours. And you might even use that ice bag on and off throughout the night. But the next day, now you can start going, especially after 24 hours, you can start going into hot and cold repetitions, like a hot and cold shower. Now, if any of you in your shower have one of those wands, that works even better. You can use the faucet under your sink and change the hot and cold. If you have a hot tub or a jacuzzi, you can get in the hot tub and have the ice pack sitting on the edge of the hot tub. But the idea is you put hot water on the area and then cold water on the area and alternate them back and forth. Now, the way to do it in a shower, if you have a wand, is to turn the hot and cold water both on and make it a nice hot shower. Then turn the hot water all the way off. Now, you're just going to manipulate the hot water on and off. So you turn it off and let full cold go on the area that's injured. Then turn the hot water back on for a minute, as hot as you can stand it. Then turn it off for a minute and take a nice cold shower of that area. Then on and repeat 7 colds and 7 hots. And that alternating hot and cold is going to do something very magical. When you put hot water on the body, it brings the blood to the surface. That's why the skin turns red. And when you put cold water or ice on the body, the skin turns white because it drives the blood deep in your body. And alternating the hot and cold brings the blood to the surface, pushes the blood back down. It forces the circulation. And anytime you force the circulation, you force the healing. And using herbs like cayenne tincture and lobelia and adding hot and cold therapy, it's the most powerful way I know to move blood in your body. And when you move blood, you free up the blockage and you reduce the drama and the trauma from injuries, especially bangs, bumps, and bruises. Now, if you're using a jacuzzi, just get your whole body in the jacuzzi, but then pull the area out, if it's your arm or whatever, and put ice on it for 8 minutes. Then take it and put it back in the jacuzzi. Or you can do 1 minute back and forth, but repeat it about 7 times. And you can even do it under the kitchen sink if it's your hand. But we're talking about bumps, bangs, and bruises. And I've seen major bumps and traumas that would have split, that would have required stitches, that would have been horrible injuries turned into almost absolutely nothing by the use of making your ice bag, bringing in some cayenne and nerve tonic, and then the next day and the day after doing hot and cold, and the next thing you're going to know, in 2 or 3 days, it's almost gone. One more very important thing, your deep tissue. You can put this on immediately too. Once you've used your ice right off the bat, and you've done that on and off and on and off, the next thing I want you to do is coat the area with your deep tissue oil or your deep tissue ointment. Remember, this increases circulation, reduces inflammation, and the 3 herbs, arnica, St. John's wort, and calendula, are especially for trauma. You could call this trauma medicine. Now, when I have someone with a bump on their head and it's close to their eye, it doesn't feel good to get my deep tissue oil or ointment in your eye or in sensitive areas of the body. So I like to apply it with my finger or a Q-tip, because a lot of times kids bang themselves right on their forehead. I will put a dab of this on and then move it around with a Q-tip, but make sure I keep it out of their eye. Now, they still might say it's in my eye because the vapors are so strong. They're going to move around and it's going to feel blinding, so just tell them to close their eye for a half hour. And then once you get the deep tissue on there, that's going to increase the circulation, reduce the inflammation, and deal with the trauma, then you continue to go back and forth with your ice. But as soon as possible, get the deep tissue on the area too. So let's look at that. Make your ice bag, smash it up, make it in a tea towel with rubber bands, smash it up. Wet it with some water, get a real cold ice bag and get it on the bump or bruise immediately. Once it's on there for 8 minutes, take it off and get your deep tissue oil or repair on that area. That's going to work right hand in hand with the ice to increase the circulation, reduce the inflammation, and deal with the trauma. And then if the person needs it, if they're going to pass out or faint, get them a little cayenne tincture. And if they need to go the other way and relax, get them a little nerve tonic. And now you've dealt with all the bangs and bumps, and forget bruises, because you won't even have any if you follow this routine. I've seen where I knew it was going to be a purple black eye, and the black eye never happened because of getting in there and increasing the circulation right away. And more importantly, I've seen many that would have split if they were just allowed to swell while you were in the car on the way to the hospital emergency room, and I kept them from splitting by using this routine. This routine right here will save you from the majority of trauma that you get in and around the house, which is bangs, bumps, and bruises.